The heart is a hollow muscular organ, somewhat pyramidal or kind of like a conical shape, as you can see here. The heart rests on one of its sides, as you can see here. And the long axis of the heart, it's directed anteriorly, inferiorly, and to the left. And it's located within the pericardial sac, which you can see right here, in the middle of the mediastinum. In terms of the functionality of the heart consists of two pumps which are working together. So we're going to have basically the right side of the heart and the left side of the heart. So on the right side, you're going to find the right atrium and the right ventricle labeled here in blue. And on the left side, you're going to find the left atrium and the left ventricle. So on the right side, let's go back into the right. The right side, basically, the right atrium receives poorly oxygenated blood from the whole body, including the actual heart. And this blood passes to from the right atrium into the right ventricle. So from there, the right ventricle pumps that blood into the pulmonary trunk, which you can see right here. And then this structure carries blood to the lungs for oxygenation. Now, on the left side of the heart, this side is for blood that is rich in oxygen. So the left atrium, which you can see here labeled in blue, receives oxygenated blood from the lungs via the pulmonary veins, which you can observe right there, those hollow spaces. And that blood, once it reaches the area of the left atrium, it passes from the left atrium into the left ventricle. And so the left ventricle pumps this blood into the aorta, which is this structure right here, which distributes that oxygenated blood to all the tissues and organs of the body via its branches. Now, there's certain features that we have to discuss, including the base, apex, the sternocostal surface, the diaphragmatic surface, and the right and left pulmonary surface. So I'm going to start here with the sternocostal surface, which faces anteriorly. The major component here is going to be the right ventricle, and minor components also include the right atrium, specifically with its auricle, the left ventricle, and the left auricle. And so in here you can see where you have the coronary arteries, right? This is the coronary sulcus that encircles the heart between the atria and the ventricles on the sternocostal surface, and it can be seen mostly between the right atrium and the right ventricle. Now, the apex of the heart, it's formed by the left ventricle, and it lies at the level of the fifth left intercostal space. So I'm going to try and see if I can refresh this. And here is the fifth rib. So about 9 centimeters from the midline, basically. And the apex beat can usually be palpated and often seen in living subjects. And the base of the heart lies opposite to the apex, so it's formed mostly by the left atrium and a narrow portion of the right atrium as well. It faces posteriorly, as you can see here, towards the bodies of T6 to T9. So if I bring the thoracic cage again, here is T8, T9, more or less, so that you get an idea. And then this is T6 right here. Now on this anterior view, you can see the superior vena cava opens into the upper part of the right atrium, and it drains blood from the upper parts of the body above the diaphragm. And then we also have this inferior vena cava that opens also into the lower part of the right atrium, and it drains blood from the lower parts of the body below the diaphragm. Also located on the area of the base of the heart, we're going to have the coronary sulcus, which you can see because the structure has been faded away. And in there, you're going to have also the coronary sinus, which if I show again, this is the coronary sinus in blue. And this structure collects most venous blood that comes from the heart, and it drains it here into the right atrium. Also, the heart has a diaphragmatic surface located here posteriorly and is formed largely by the left ventricle with a smaller contribution from the right ventricle as well. And in here, there's going to be a posterior. Let me see if I can. Okay, here we go. There's going to be a posterior interventricular sulcus, which is actually on this area where you would see the middle cardiac vein or the posterior interventricular vein. And basically, this forms the boundary between the right ventricle and the left ventricle on the diaphragmatic surface.